this is the last section of the neonatal care during COVID, which is to be provided for neonates. And in this section, I will be covering the newborn care to be taken on discharge and after discharge from hospital. The most important thing here, once the baby is born and the mother and baby are stable, is to counsel, communicate and educate parents regarding the disease process COVID-19, its effect on their baby and the infection control practices to be followed particularly at home. So there are certain best practices for the mother to be practiced during the infant care. First, hand hygiene. It can be hand wash or the use of alcohol-based hand rub. The alcohol content should be at least 70% or more. Next, respiratory etiquettes. She must wear a mask while she is feeding the baby. This is to be followed particularly when she is positive and the baby is well or the baby is negative. She must clean and disinfect the surfaces in her room frequently. A symptomatic mother must continue to wear a face mask till the symptom resolution or she has been afebrile for about 3-4 days. Cleaning of the breast with soap and water is essential if the mother has a cough. If the mother does not have a cough, the nipple area should be just kept clean. It is unnecessary to wash her breast. And mother must be encouraged to continue breastfeeding. She must be explained that the best breastfeeding is the best that she can give for her baby, and it has the antibodies to help the baby fight any infection. So discharge from hospital, how is that decided? If a mother is COVID positive and is asymptomatic and the baby is asymptomatic and whether COVID positive or negative, in both cases the baby and mother dyad can go home. So the mother and baby can be kept together. The parents, as I have mentioned earlier, need to be counseled regarding infection control practices, breastfeeding, rooming in and home isolation. So the mother and baby, when they reach home, they remain in a separate room and follow all precautions. The mother continues to breastfeed the baby. If the baby is COVID negative and the mother is asymptomatic also, they both can be discharged, but infection control practices will have to be reinforced. Mother can do breastfeeding and KMC. In case a mother is symptomatic and the baby is well, then the mother and baby are kept separately and the baby can be discharged home with a COVID negative caregiver, where the caregiver can take due care of the baby. In that case, the milk will have to be given as either expressed breast milk from some other lactating mother or a formula feed, but this formula feed should not be through bottles. So bottle feeding practices should be avoided. And in case the mother is symptomatic and the baby is negative, definitely they need to be separate and baby is discharged home. In case a baby is sick, whether COVID positive or COVID negative, the baby is transported to the SNCU or to the NICU as per hospital protocol. Once a COVID positive baby is well and goes home, a repeat testing is not essential. Only frequent OPD follow-up should be done. This could be telephonically or through telemedicine or in office consultations. And once about 14 days later, they must come in or come in and show the baby or contact the hospital earlier if necessary. The red flag signs would need to be explained. In case the baby refuses to feed, develops tachypnea, is looking dull, has an altered sensorium, they must report to hospital immediately. So counsel and communicate regarding the disease process, home isolate the couple in a separate room and avoid handling by elderly relatives more than 60 years of age. Teach the mother hand hygiene and its relevance, respiratory mask and its etiquette, breastfeeds only, feeding advice should be given. She must wash her hands, wear a mask before she feeds the baby, and in case breast milk substitutes need to be given in case the mother is symptomatic and in hospital and a separation has been advised, then bottles should not be given. It should be through a vati and spoon. So, but Finally, I would like to say that the benefits of early breastfeeding far outweighs the risk of COVID-19. Immunization and follow-up. Immunize the baby as per the national guidelines. BCG, OPV and hepatitis B could be given before discharge, and stable COVID positive babies, in case they fall sick, should come in within 2 weeks. Follow-up policy is similar to any NICU graduate. So the key messages here are: neonatal COVID-19 infection is relatively mild. Severe infections are very rare. Transmission through breast milk and placenta are very rare. Routine obstetric practices and neonatal protocol should be followed. Recurrent nasopharyngeal testing for a COVID positive baby is not required. Breastfeeding is the best that can be given, and a strict infection control policy must be in place and should be conveyed to not just the mother but to her family members, and good housekeeping routines both in the labor room, the postnatal ward and the mother at home should be performed. Thank you.